Welcome to the Registry Insider. I'm Bill Seifarth, CEO of the National Registry of EMTs, as well as host for this podcast. And I'm excited to have with me today Dr. Christian Martin-Gill, who's the president of the Prehospital Guidelines Consortium, as well as associate professor for the Department of Medicine, University of Pittsburgh. So, Chris, thanks for joining me today, and welcome to the podcast.
Thanks for having me on. I appreciate it.
So today we're talking about what the Prehospital Guidelines Consortium does, what is that organization, and in particular, their biggest product, which are the review of evidence-based guidelines for EMS. So Chris, what is the PGC, the Prehospital Guidelines Consortium? What do you do, and what can you share with our listeners and viewers as it relates to PGC?
Yeah, so I appreciate the time to talk about the Prehospital Guidelines Consortium. It's an effort that's been actually underway for over a decade now. So back in 2013, the National Highway Traffic Safety Administration, that provides so much support for EMS and for the advancement of science in EMS, collaborated with the National Association of EMS Physicians to create a national strategy that would promote evidence-based guidelines for EMS. And this was recognizing that back from the Institutes of Medicine report, back from recommendations from the National EMS Advisory Council and the Federal Interagency Committee on EMS, all of these bodies were emphasizing that the care that we provide out on the streets needs to be based on scientific evidence. And over the preceding couple of decades, we really had seen an explosion of research that was helping to support the things that we're doing out in the pre-hospital environment. And what evidence-based guidelines allow us to do is to synthesize all of that science, all of the research studies and all of that knowledge into guidelines that provide recommendations for care, which is actually clinical care or operations, and that allow us to better know what we should do because we have the scientific basis for it. And what we wanted to accomplish back in 2013 was try to come up with a strategy that would bring together a lot of organizations that are nationally interested and involved in advancing science in EMS, like the National Registry of EMTs, and along with NREMT and organizations like the American Heart Association, National Association of EMS Physicians, American College of Emergency Medicine, the American College of Surgeons. There was actually a group of 57 stakeholder entities that were involved in creating this national strategy to advance pre-hospital evidence-based guidelines. And the number one strategy point that we came up with, that we identified, was that we needed a consortium that would allow us to bring together all of those organizations that are working in this space collaboratively and sustainably over time. And so the Prehospital Guidelines Consortium was born in 2016. And that entity currently has a large representative group of about 35 organizations that include member organizations and affiliations with federal entities, research institutions, and the like, that are all interested in working in the space of trying to collate that science into recommendations for care. And the PGC today helps to bring those together.
Awesome. So, obviously, the evidence-based guidelines is at the core of what you're providing for EMS EMS educators, as well as EMS regulators, as well as other physicians. And your website, by the way, prehospitalguidelines.org, is the place where folks can go to find this information. But so you have on there the systematic review of evidence summary, as well as the professional reading list. What are those two main products that are out there, and who can use them? What cost is there associated with accessing them? Tell us a little bit about those main products for EPGs.
Yeah, so now that the PGC has been well established over the past decade, we have gotten into a collaboration with the National Registry and have been creating now every 2 years for the past 3 cycles a systematic review of all evidence-based guidelines that we can identify have been published, as well as a reading list of scientific publications that we think EMS personnel should be aware of. This parallels what physicians do to maintain their clinical knowledge and to be up on the literature. It's common that physicians will read specific publications to recertify or to make sure that they're up on the latest science. And so we wanted to identify what those publications are that would be of greatest relevance to EMS personnel. And so what we have been preparing is a list of what those highest quality evidence-based guidelines are, and a separate list of the highest quality scientific publications or review articles or other scientific literature that EMS personnel should know. Those lists are available at prehospitalguidelines.org when you look at the resources that we have on there. And we actually have provided evidence summaries, so simple 2-pager descriptions of those publications so that they're easily accessible, free of charge to all EMS personnel.
So keywords there, free of charge. They're easily accessible, prehospitalguidelines.org. And, I'm looking at your website right now, so you can just simply click here, look at those summaries, and educators can use them to incorporate within their initial education. Training officers and educators can incorporate them within recertification education. We at the National Registry, I will tell you, are strongly encouraging educators to incorporate these evidence-based guidelines both within initial and continuing education opportunities for EMS clinicians and EMS students. So prehospitalguidelines.org. So you have the 2022 lists up there, the systematic review, and then the professional reading list. Can you differentiate what is the difference between the systematic review and then the reading list? You kind of talked about it, but go a little bit more in depth as far what's the difference between the two documents?
Yeah, so an evidence-based guideline is a publication that synthesizes all of the available science, trying to answer specific questions and provide recommendations for clinical care operations. And we systematically scan the literature over the preceding several years to find out what all of the pre-hospital evidence-based guidelines are that are out there, and then rate the quality of those guidelines so we can identify which ones meet National Academy of Medicine criteria for what we would describe as a high-quality guideline. Okay. And then we want to emphasize that it's those highest quality guidelines that we think that EMS personnel should really be familiar with, the ones that recognizing that there's now a new EMS guideline once a month published in our literature, even more frequently than that. And so we want to identify those that are the highest quality guidelines. And separately, we want to identify scientific literature like a randomized controlled trial, large retrospective research study, a review article. These are primary scientific literature publications that we also think are very valuable, because when that landmark trial comes out, and it's something that's going to change practice or potentially could change practice, it's something that the average EMS provider should actually know about. And we should make sure that we provide the resources for anybody to be familiar with those latest studies. And so that reading list focuses not on the guidelines, but instead on those primary scientific literature publications that we think everybody should be aware of.
Awesome. So thank you for differentiating that. So obviously we have 2022 up there, but this is 2024 now. So what's coming up, or by the time this is this podcast is released, they might be available. So tell us a little bit about what's coming attractions for 2024.
Yeah, so right around the same time as we're able to make this available, we'll be making available the educational summaries for our evidence-based guideline systematic review, as well as for the EMS professionals or EMS research reading list. And those will be available on our website, prehospitalguidelines.org, freely available for anyone to just, within 2 pages, get a good summary of what's out there. And it'll be a good way for people to know what the latest science is from the preceding couple of years. And we aim to continue to provide those updates for our EMS community every couple of years.
Awesome. And in partnership with the Prehospital Guidelines Consortium, the National Registry is happy to continue helping every way we can to get the latest evidence out there. And if we can, eventually, I'll be honest with you, I'd like to incorporate that as a requirement for recertification as well as for initial certification, so that we know that the education and then the correlated certification related to it is relevant, current, and meaningful, which is what the EMS clinicians and our system of EMS deserves. So can you give us any, as it relates to the 2024, is there anything significant that is going to be published that just for coming attractions? By the time this podcast is released, I think it's safe enough to say that you'll probably have that released. But can you give us maybe a preview of some of the evidence that you'll be putting in the 2024 review or the reading list that might be a bit more of controversial or a bit of a change?
Certainly. So several guidelines that have come out in the past couple of years are ones that some individuals may have actually heard about. So there was a recent evidence-based guidelines for pain management that is very important. Obviously, trying to identify ways that we can best take care of patients with different medications, different dosing strategies, and by different routes would be something that's important. And there's a lot of literature that's been published out there that would help better inform protocols in clinical practice in what we do. Anytime we do any of these systematic reviews, we get publications or recommendations for cardiovascular resuscitation. So publications from the American Heart Association or the other resuscitation councils, which are continuing to update the science on how we should deliver advanced cardiac life support type care and do other aspects of first aid or resuscitation. And we've also seen new guidelines for trauma triage in the field. And those guidelines are ever changing as well, maybe just with smaller tweaks in terms of what everybody may be used to right now. But better understanding how to incorporate specific components of triage and how that should inform what hospitals we go to or how we take care of people in the field is very important and evidence-based. And those guidelines help to incorporate that. So, yes.
So guidelines on pain management, guidelines on resuscitation, which I assume are aligned with the American Heart Association guidelines, as well as trauma triage. So good evidence coming forward in the 2024 review, which again, from an educational perspective, a continuing education perspective, it's important to make sure that educators, training officers, and medical directors incorporate these within their curricula, as well as within the protocols, ideally. So this is an exciting opportunity for the PGC to kind of, as multiple organizations, push forward and advocate for current practice, evidence-based practice within the classroom, as well as ultimately in the back of an ambulance where we're providing emergency medical services. So very cool. Anything else as far as coming attractions for PGC, a Prehospital Guidelines Consortium, as far as what you're working on, or projects that you want to share while we have the attention of listeners and viewers?
Yeah, well, there are really two things I want to make sure folks appreciate. One is actually a shout out to all the educators, which you have already identified are key to us getting this type of information out to everyone. There are two items that I want to emphasize here. You are already providing a shout out to those EMS educators out there, and I think it's very important for them to consider how this type of information may be incorporated into the education that we're providing to EMS personnel. So if you're an EMS educator out there and maybe you're going to give that refresher about chest pain or cardiovascular care, that talk on OB in the field, those OB emergencies, if you look for these guidelines or these new scientific articles that have been published, and you're able to proactively make sure that you're aware of what the latest science and the latest publications are, then that allows you to make sure that you're incorporating some of that latest science into those maybe PowerPoint and other presentations that you've already been delivering year after year. And we want to make sure that we provide you the easiest resources that can help you incorporate that latest science into the education that we're providing every year, so it's not the same thing all of the time, and we can make sure that EMS personnel are up to the day in the latest science. The other item that I would The other item that I would emphasize is that the PGC is working a lot in the space of implementation science. So along with one of my colleagues, Dr. Jen Fish, who is the chair of our Dissemination Implementation Committee, we're trying to identify how best to implement the guidelines. It's one thing to know that there's a great scientific review out there and recommendations that are truly evidenced in the latest science. It's another thing to actually implement those guidelines into the care and operations that we're using out in the field. You might think about the American Heart Association guidelines as being some of the most respected and established guidelines that feed the cards that we carry in our wallets, maybe. Those are guidelines that can still be a challenge to implement. And for EMS systems to be able to incorporate those and medical directors to update their protocols to be consistent with the latest science, that can be challenging. And so we're looking at what components of implementation science are best applicable to the EMS environment, and how can we facilitate for our community to best implement guidelines and science into the things that we're doing every day.
Awesome. So that's quite insightful, quite helpful, and the Prehospital Guidelines Consortium doing a lot to move EMS forward, to advance the profession, but more importantly, to make sure that the care that we're providing and the education that's received and delivered actually to EMS clinicians is relevant, is current, and certainly meaningful. So, I will tell you on behalf of the National Registry of EMTs, Chris, we appreciate the relationship that we at the National Registry have with the PGC, and we look forward to continuing to foster that relationship and continue to benefit the EMS profession that we all love and want to make sure it continues to do great things. So,
on behalf of the PGC, we also appreciate that collaboration. It's great to see that together, our organizations and a number of other organizations that are working collaboratively can actually help to make sure that we make folks aware of the latest science in EMS and that we actually implement it into the things that we're doing every day.
Awesome. So, Dr. Christian Martin-Gill, appreciate your time today. And all of our listeners and viewers, again, you can go to prehospitalguidelines.org to find out more. And as always, thank you for what you do in EMS, and stay safe.
Thank you, Bill. I appreciate our time together.
Thank you for joining us for this episode. If you wouldn't mind, please click the like and subscribe buttons, as well as the notifications so you can get notifications of upcoming episodes. Also, for the latest and greatest happenings of the National Registry, feel free to go to nremt.org. Thank you very much. And again, stay safe.